What, in your view, you don't have to spend 15 minutes on this because I know we're running a little long. What is the system supposed to look like? How should this look? We have public option, some private stuff mixed in. We talked about dental and talked about a few other things. How should this look for the average person? I'll start with you. What should people be after here as an ideal sort of setup?
Well, I think as far as the public system is concerned, the two things that need to happen is to end the block funding, so make patients, hospitals and clinics and centers wanting patients, and then a care guarantee, and then solve the doctor and the nurse shortage, which easily, unfortunately, it'll take that to generate increase medical schools from within. It's going to take a while, but there's nothing to stop us from enticing those 3,500 Canadians back to Canada. The trouble is, a lot of them, probably the majority of them, you're in your early 20s and you go to Australia or Ireland, and you might meet an Australian or an Irish man or woman, and they never come back. Well over half of them don't come back. So there are lots of things to be done, and we can entice the nurses back. As you probably know, 2,000 nurses commute from Ontario down to the United States every day.
I did not know that. That's an insane number. That's an insane number.
And the reason is, contrary to what governments say, there's a nursing shortage. If you look at OECD data, we actually have a higher than average number of nurses in Canada, but they aren't being offered full-time work or benefits. They're there when the hospital wants them, so hospitals only want to give them part-time or casual work, and a lot of them, they all want full-time jobs, and with benefits that they get down in Buffalo or down in the States. And 2,000 a day are commuting to work in the US. As I say, the biggest problem is governments have let it get so bad that there's going to be a cost to doing it. And I think one of the solutions is to let those that can afford it pay a bit more, which is true socialism, by legalizing that option for private insurance, and forget this, it's going to suit the rich. The rich don't suffer in any society.